Hello, everyone. We are here today with Ogechi, my friend and sister. Ogechi and I have known each other for the past three years, and though we don't see each other all the time, we do try to make the time to connect here and there. Um, Ogechi is a clinical ICU nurse and also a clinical RN supervisor in home healthcare. She is deeply passionate about patient advocacy and making sure that patients and their families feel heard during some of their difficult times. Beyond her career, she is a wife, a mother of three boys who are so beautiful. She also speaks openly about balancing her career growth, family life, and finding the time for her me time. So today we'll be talking to her about her journey, her experience in healthcare, and the importance of compassion and cultural understanding when caring for other people. Hi, Ogechi.
Hi.
How are you?
I'm good. How are you?
I haven't seen you in how long?
It's been a minute.
Wait, I think on your baby shower.
Yeah, that was the last time. So
Yeah.
that was last year.
Last year.
Yeah.
How you been?
I've been good. Busy, trying to adapt, with 3 kids now.
Right? It's a big change.
Yeah, it's a big change going from 2 to 3, but we're doing it.
That's good. That's good. All right, so go ahead and introduce yourself.
So my name is Ogechi. I'm a registered nurse. I did start my nursing career in the ICU, medical ICU. I still work in a medical ICU. I do travel now as a nurse, but yeah, I got into that last year. Yeah.
Oh, nice.
I started last year after I had my son.
Okay.
And I like it better because of the flexibility.
Gotcha.
You don't have to deal with the politics in the hospital, and I get to spend more time with my children. I can get that time off when I want it. So that's been helpful. And I'm also in the home health aspect. I am a nurse supervisor for my dad's company in Georgia. And I also do home health here as needed for a major hospital. So that's like wrap up my career.
That's nice.
Yeah.
That's amazing.
Yes.
You've done well.
Thank you. I hope so.
And you've really done well. Listen. Especially being a mother too, balancing all of that. It's amazing.
It's a lot.
I hope to get where you are. I hope to get there.
I think you're doing well. Okay.
All right. So I know you're a busy person. We'll just dive into it. And I'll ask you the first question. Okay. I know you were born in the US, raised here, but also know some people struggle with navigating cultures through family and community. What was the experience for you growing up?
I am, as what they say, the Ada of the family. So I am the firstborn. Yeah.
I know all about that.
Yes. So, challenges are there.
They are. Sure.
I had to grow up fast. I had to learn responsibility quicker than my siblings had to learn.
Of course.
I couldn't make mistakes. And when I did, it was, so
I get that.
Yeah, it really played a big part in who I grew to become. I felt like it actually took, my parents are very traditional Nigerian parents, very strict in cultural values. So I think that played a huge part in who I became today, how I navigate life.
Right.
And we also grew up around a strong Nigerian community in Atlanta. I felt like that also played a huge part because they were there to celebrate our milestones,
Right. Right.
And that's something I miss living here in Raleigh for my children,
With the culture,
yeah.
knowing the background.
Yes,
You may
yeah.
not be back home, but
You still have that
culture.
feel, and I feel like Riley hasn't really gotten there yet. They're still growing into that.
Right.
But that really played a big part for me. My parents were very strict about education. My parents came here as immigrants. My dad came here in the 80s, went to college. My mom came here in the 90s, also went to college.
That's nice.
Yeah, did her surgical tech program, went to nursing school. So when my parents were gone, it was my responsibility to be there for my sisters, So I felt like that helped me to be more mature in a lot of ways that my age mates didn't have that, and I felt like even though like I had some mishaps growing up, it's still, I still had those values instilled of me, and what I wanted to do when I got older. I felt like everyone has their own path, and I ended up finding my path in college, even though it took a while, but that instillment allowed me to be more disciplined, allowed me to navigate having a family while going to school. Yeah. Right. Because I had my first child already before I even decided about going to nursing school.
Oh, really?
Yeah.
Oh, I didn't know.
Yeah. So I have a bachelor's already in biology.
Okay.
My plan was to do pharmacy school. That didn't work out. God has a way to say, this is what I want to do, This is the path I want you to go into. A friend of mine who's a nurse in Atlanta, she was like, Ogechi, she called me my Ogechi. She's like, why don't you try nursing? So I thought about it. My mom mentioned it too. And I applied, immediately got it.
You see that?
Yeah.
See that?
So that's what started my journey. So I already had my son he was one. He was 1.5. Okay. And I felt like if it wasn't for my husband who was very supportive, my family in Georgia, my friends, I don't know how I would have been able to do that.
It's hard.
Yeah.
It's important to have that supportive, as we call it, your village.
Yes.
And having
I had that village.
Spouse, it's a plus.
Yeah.
It's a plus.
Yes.
Good. Do you feel like your upbringing shaped the person you are today?
Oh yeah, definitely. Yes. I always tell my parents they left a little bit of trauma in me. But when I look at how my life played out, I feel like my upbringing played a huge part in where I am today, how I navigate being a mother, how I navigate being a wife, and how I navigate in my career. A lot of people you meet, they start off nursing without like a family. They're starting nursing, graduating 22, getting into nursing.
I know.
Yeah. But me, I was like 30 when I started nursing school, or when I finished nursing school, I think I was 30. So it was just like my path was completely different. So I had to remember my foundation. I had to remember my mom also went through that same route. Like she had a family before she started school, So I just had to remember like I'm not the only person that has gone through this journey. So I feel like my upbringing played a lot, like what I observed growing up, how I saw my mom's strength, her discipline, still finding that time to be with her children, make sure there was food in the house, make sure her children, had everything they needed for school, So like there was no excuse for me to not be able to carry that same, like, I don't want to say load, but carry that same desire or character that my mom had.
I do have another friend that's in nursing school right now too. She also has 3 kids.
Oh wow.
And I'm like, I don't know how you do it.
Yeah.
Again, like you said, I was 30, 31, I think, when I went back to college. I'm still in right now. And being in school with 20-year-old kids,
it's different.
They have the whole time
Man.
to do this. I'm here struggling working full time,
Yes.
dealing with family.
Yes.
I'm like, it's crazy.
Yeah.
But to do nursing on top of that, kudos to you
Man,
guys.
man.
Because it's not easy.
It's not easy.
Being an
Yeah.
adult and being at school, but then
It's the
again,
ghetto.
but like, it's ghetto. But then that's what I keep telling my younger
Yeah.
sisters. I'm like, you do it when you're young. You do it, especially if you have the opportunity.
Yeah.
For us, it was like we had. I would say for me at least, I didn't have the guidance.
Yeah.
I decided because of some things that are going on with family that I'm stuck in school for semester.
Yeah.
And then it just got out of my hands. And I was out of school for three more years before.
And I feel like that's what's part of being like the first child, you know? Like
you are the trial and error.
Exactly.
Of everything,
Yeah. Yeah.
So yeah. Okay, so for the next question, do you think working in healthcare, you meet patients from all walks of life?
Oh, yeah.
All backgrounds, all different cultural and immigration backgrounds, right? How important is cultural understanding when you're caring for a patient?
I feel like it's very important. We live in a state where discrimination is very much alive. Okay. I've seen it in the hospital system. I've seen it within my coworkers. People choose to remain ignorant, you know, even patients, they choose to remain ignorant. Like I'll come in, they're looking at my badge and I already know the first thing they're going to ask me
is where you from.
Yeah. You know, they're just looking like, and they'll be like, how do you say that name? You know, I'll tell them and they're like, where's that from? And I'll tell them, I'm Nigerian. Oh, you speak very good English. Okay, I don't know what that's supposed to mean. I don't know what that's supposed to mean. My immediate response is English is the first language. You know,
in my country.
Yeah. So, you know, and then when I'm dealing with patients, or when I see coworkers who are dealing with patients from other countries who don't speak English as their first language, who have different cultural background, maybe they're Muslim, Jehovah's Witness, you know, then it's like, oh, this person is standoff, or this person is this, and I don't know, I have to do this. You know, it's just like, they don't want to accommodate.
They don't.
You know, they don't want to bring themselves down and level with the person. Yeah. You know, and in healthcare, I feel like, especially in the South, there's not enough representation of us. You see a lot of like nurses from African countries, but it's, I don't want to say limited. I just feel like the specialties they go into are not mostly like ICU, you know, critical care. They're mostly seen like med-surg or step down or dialysis, you know. And I feel like a lot of us are needed more in that critical care space, because we're getting a lot of patients that are from different backgrounds, patients that look like us, who need people that understand them, you know. I don't believe in judging anyone from where they're from. I don't believe in making personal judgment based off the report that I'm given from a nurse, you know, because your experience is not going to be my experience, you know. So I think it's important to respect people's values, respect what they want for their care, and treat them like you would treat your family member who's in the hospital. That's my go-to. That is how I start my day when I'm at work. You know?
I think that's how we all should nowadays. That's the model we all should go by. Because again, like even me at school, when you say your name, people are like, "Oh, I know your accent."
I'm like,
okay. I know I have an accent. You didn't have to point it out.
Yeah, and I'm just like, you have an accent too. You got a Southern accent. Accent, you know, I'm not pointing that out.
And honestly, that discrimination, I feel like it's everywhere. Yes, because I would say I wasn't aware of it 100% until I joined the military.
Yes,
I go into boot camp and everybody I was the only, I wasn't the only black woman in there, but I was one of few. Oh, wow. And I was the only one from a different country. So had a different accent. So it was a struggle. So that struggle.
I got chills. I'm just thinking about like, you know, this world is just, it's different now.
It's very different. It's very different.
Yeah.
Have you ever had an experience where cultural awareness made a big difference in somebody's care?
Yeah. I had a patient who was Jehovah Witness. They floated me to another unit. It was, I think, it's like a kidney unit or something like that. I can't remember what exact kidney transplant unit. So they transferred me there. She was an African American patient. She was Jehovah Witness, and that I remember it was a night shift. So it was night shift when I came, and I remember going in. She was just very reserved, very quiet, and of course, like for Jehovah Witness patients on the doors, they always say like, talk to nurse before you step into the room, because if you're drawing labs, you have to be careful the amount of blood that you're drawing. Yeah. And also because they don't accept blood transfusions, you need to be careful to make sure that you're not, doing anything that's against their religion or their culture. So I walked in to talk to her, just introduce myself. She was a little bit cold, but I was just like, okay, I feel like maybe she feels she hasn't been receiving the type of care that she has expected to receive. She had a lot going on with her diagnosis. Her health was in bad shape. So I asked her, start off like, how's your day going? Trying to start conversation with her. She ended up telling me like she's been there for 5 days and no one has given her a bath. Yeah.
Wow.
So I was like, I'm gonna give you a bath tonight, and that's where I come in with how it's different how I feel people that don't look like us communicate differently with people that look like us. And I don't say that in a negative way, but it's what I noticed in healthcare. They pay less attention to us. They just want to come in, do their medication administration, step out the room, and that's it. But you fail to realize that these patients, sometimes they don't even have a family member to come and see them. They don't know if they're going to wake up the next morning. They don't know what the rest of their life is going to look like with their new diagnosis. So it's things like that when you're not being aware because you've already put a label on them, or like with patients, we'll have patients who don't eat pork or don't eat certain type of meats, and you will see like, okay, a mistake has been done on their lunch tray, and a nurse is complaining about, well,
I have to go change it now.
That's not my problem. That's not what that it's not my fault. They don't, things like that.
Yeah.
Like I said, it goes back to ignorance.
It is.
Yeah.
It is. Hearing you talk, I can say that you really care about patients.
Yeah.
Right?
Yeah.
So in your experience, do immigrant or minority families sometimes struggle to take care?
Oh yeah.
Oh yeah.
Definitely. Yeah. I'm not an immigrant, but I'm a first gen, in this country. And I feel like sometimes it's hard for me to be heard, So imagine somebody that just came newly to this country, someone who doesn't speak English. It's very hard for them, especially like when I think of our Spanish speaking patients. A lot of times I feel like they're pushed to the side because they don't speak English. They don't understand English. And then it's like a nurse gives up or a provider gives up because, oh, this is just too much. I just, I can't keep using the translator. I can't keep things like that. And then I don't feel like education is provided to them the way it would be to someone who speaks English. Then you see they're coming back to the hospital for the same. I feel like cultural awareness needs to be, they try their best in hospitals, with education, trying to teach us how to, be more aware when it comes to different cultures or different race or, things like that. But I feel like, but just because you do a couple modules on it, is much different than actually coming in and talking to your nurses, talking to your providers, and giving them that education. Because even with the things that passed, with administration about like the ICE agents, that was a big thing that was occurring in hospitals. We were getting emails about how like we are not allowed to share information about any patient who was there who was not a legal citizen.
Right.
But I remember like there was this one nurse. He was a charge nurse actually at one of the hospitals I traveled to. And he made a comment saying that if he had a patient who was not legal, he would provide the care and then call, to report that, And that's someone who was in the military, who,
See that?
Yeah. So, like, when I heard that, and then I heard the other nurses, like, agreeing with what he said, I was like...
That's messed up.
Yeah.
That's really messed up.
And at that point, I had to speak up, and he was like, why do you feel like what I'm saying is wrong? And I'm like, because I just picture if that was my husband or my parents who were not legal and you took care of them and you're like, okay, now it's time for me to call and let them know, like,
you gotta put yourself in the
I said that's where my first thought goes to.
Yeah.
So, it's heartbreaking that those are the kind of people that you work with.
Or you have to. This is one of the reasons where, like, when my mom has a hospital appointment, I make it like a priority for me to go with her.
Yes.
Because I'm like, one, they can even translate. But is it gonna be it? And sometimes we come in and be like, oh no, we don't allow family members to translate. And she'll just be like, no, I don't want nobody else for her. So and when you talk about Spanish people, sometimes I've thought they will have a little bit easier because it feels like there are some Spanish people working in hospitals, but at the same time, it's not gonna be the same. Like we all from here, we don't speak English. We have to start learning this language. And it's just
it's hard. It's different. Like you're coming to a new place. The place is different. You're having to follow different rules and.
Having to pick up. Even saying good morning.
Yes.
What is
good morning? It's like, it's a whole new world.
It is.
And then when it comes into, I need to get help for my health, then you become afraid of even going to get that help because you don't know where it's going to result to,
Yep. So people stay home, they're like, I'm having fun.
Oh, yeah.
Even if you go, they're like, oh, there's nothing wrong with you, things like that. People just, it's amazing. When you get into your family, you're a wife, you're a mother, and a healthcare leader. How do you balance your career, your family, and still find the me time?
I feel like I'm still working on knowing how to balance everything, but I feel like because I have a partner who's so supportive and who's always encouraging me to rest, it plays a big difference because in our field, we're working 12, 13 hours. We're burnt out. We see death. We see all these things. And sometimes it's like after your shift, it's like you just want to sit in your car and just like,
I get it.
So it's like when you come home, your job is not done because you still have children. You still have a husband that you need to attend to. You need to make sure that they're not forgotten. So I always make sure, like, on my off days, I try to make sure. I've been doing better the past couple weeks. So I always make sure I'm resting. Make time to go to the gym when I can. Like, go get a massage when I can. Do my nails. Like, all that is things that relax me, I try to also... Also, like during my kids, my kids have lots of activities that they're in. On my off days, I always make sure that I'm present for those activities because when I'm at work, they don't see me. They don't see me before I leave, and they don't see me when I get home. So my off days, I'm making sure I'm there to pick them up from school, or I'm there to take them to swimming, or take them to extra activities. Things like that. It's not easy. It's not easy, but I feel like when you work as a team, it takes that load off of you.
I'm sure.
Yeah.
So, what do you have for young people from immigrant or minority communities who might be interested in going into nursing?
Do it. Nursing is, I'm not going to say it's easy because it's not. Nursing is a challenge, but I feel like if you have a few people you can meet in your class that are also, that you can make part of your community, it makes the journey easier. Whether it's people that are from where you're from or people who understand that, you might be going through a challenge, make those people the part of your people that you can study with, people that you can, go get like coffee with, I feel like that helped me in nursing school. I feel like also like find schools, like 2-year schools, you can go do a prerequisite course in. And like I tell people, like I've mentored a few like immigrants who have come. They've reached out to me on Facebook because like on Instagram, they saw like me posted on the school that I went to. So they'll reach out to me and they'll be like, hey, do you have like some advice? I always tell them like nothing is wrong with getting an associate's in nursing. Get that associate's. It's a 2-year program. And then start working and get your job to pay for you to go back to do your bachelor's. People, I think it's common where we're from to look down on associate degrees. That high. And I just feel like it's a stigma because you don't want to come to this country and put yourself in debt.
No, you don't.
Yeah.
No, you don't.
Because then all your money that you make is going to go into your loans. Yeah. So nothing's wrong with that. You finish faster, you start working, and then go back to get your bachelor's.
Baby steps.
Yeah, it's not a race, it's not a competition. Take your time. Also, like get advice from like advisors. Get advice from friends or people that you may run into that are also in the profession. To seek advice from them to see what they feel is the best path for you to go.
Because I also know that some people they start as home health aides, then they do the LPN. I think after the LPN
they do the RN, and that's an online course. You can do like if you're LPN already and you want to go to an RN online, you don't have to go to a school for that. And it's like I think a 1-year program.
Yes.
LPN to RN.
Yeah.
You start working as an RN, and then you can go back if you want to do your BSN. So it's just like
one, you have a job that's helping you do your school. Probably maybe some hospitals will help you do your school too.
And a lot of hospitals are doing that now. They're helping like people go back to go get their BSN.
That's good. People need that. I feel like if you go into school and you don't have to pay for it, which I'm grateful for. Military. I am going to graduate with my bachelor's.
That's awesome.
And I'm like, this is it's the biggest blessing that I could ask for. But it's whatever ways that people can find
exactly.
To go to school and
just
not
do
have
it.
To be in there. Okay. So for our closing question. What does purpose mean to you at this stage in your life and career?
In this stage of my life and career, I think purpose for me is achieving what can help my family and what can help me grow to be a better nurse, let's see how I can word this. Be more than just a RN. I don't want like my title to define who I am. I want to know like when I'm outside the hospital, my character is also showing in the midst of the people that I'm with. I want my children to be able to look at me and say, oh, that's my mommy, she's a nurse. I'm so proud of her. Like, I want to be like my mom when I grow up, I want my children to always, look back when they get older and say like, my mom did this and she still was able to make time for me, make time for my dad, or, you know, make sure that she spent like some time with us, you know. I never want my career to be my whole life, you know, because there's so much more outside of your career. Even like there's so much more being outside of being a mom and a wife, you know. When people think of me, I want them to speak highly of me, but also remember like what I stood for, you know, whether it was in my profession, whether it was outside of my profession. I think that's like my purpose, like why I do what I do, you know, and why I go harder. Sometimes like my husband's like, you need to slow down. But you know, I have my end goal, you know. So it's my purpose is what drives me. Yeah.
That's good.
Yeah.
And yeah, your personality shows that.
Thank you.
Like I said, we just met through a party. So it does show whoever you are. I remember we met in the elevator.
Yes, we did.
Oh, she's very well dressed.
Yeah.
That was my first thought. And then we got to sit at the same table.
Yeah.
And
we just hit it off. We were just vibing.
You're just there.
Yeah, we were like, oh, you're 30. I'm 30.
Exactly.
We were like, they were the same age.
It's hard to go into these areas.
Yeah.
Someone who's 30.
Yeah.
I'm always with someone who's 25. I'm like, you're too young to be.
Yeah, you're too young. You're not going to relate to me.
Exactly.
Yeah.
All right. So on a fun note to end this interview, coffee or tea?
Tea.
Right. I'm a tea person.
Okay. So I like tea better than, okay, I'll only drink coffee when I'm going to work.
Okay.
But tea on an everyday, like I have to have my green tea in the morning and my mint tea at night.
Right?
Okay.
That's me.
Yes.
So the point of that is like green tea before anything else.
Yes.
And then mint tea at last.
Yes.
So I can relax.
Yes. So that's me.
Right. Well, thank you, Ogechi.
Thank you.
It was fun having you.
Thank you.
I appreciate your time.
Thank you so much.
You know, taking that busy life
Aww.
and just being there with you.
Thank you.